Good afternoon. Welcome to our second session in our very first virtual Successful Aging Expo. Today's session is hearing, the connection between hearing loss and brain health. Should be fascinating. My name is Al Manzi. I'm the president and CEO for Prairie Mountain Media and publisher for the Times Call. Let me remind everyone to visit the Expo through our Times Call website and support our sponsors, and also take a visit through the Expo. After our presentation today, we'll have about 15 to 20 minutes for questions and answers, but you can ask them at any time during the talk by using the chat or the Q&A buttons at the bottom. So feel free to do that, and then we'll organize them all at the end. Today, we're lucky to be joined by Dr. Deanne Rudden. She is a doctor of audiology and owner of the Longmont Hearing and Tinnitus Center in Longmont. So please join me in welcoming Dr. Rudden.
Hi, everyone. Good afternoon. I'm really happy to be here to share some information that may be new to you and hopefully give you some food for thought, if nothing else. I'm going to go ahead and share my screen. I have a little presentation for you, so bear with me here. All right. So the topic for today is understanding the connection between ears and hearing and brains. So your ear is really the sensory organ, right? So it's taking information in and your brain has to make sense of it. So how does that work in terms of keeping us not only in good hearing health, but in good cognitive health? Because there is a link between them. So the things that I would love for you to get out of today's presentation is understanding how audiology fits in overall wellness checks. So we think about wellness checks as, you know, checking our blood pressure, checking our eyesight annually, maybe getting your teeth checked, getting your body checked, but oftentimes ears and hearing kind of take a back seat to things until there's a problem. We believe, audiology believes, that hearing health should be a part of your overall wellness. The other thing I'd like for you to understand a little bit more specifically is the connection between your brain or cognitive performance and your hearing. And then how about hearing or cognitive screenings? How does that work? Because we now have tools in our arsenal to get an idea of what your cognitive performance would be, and also how you can keep your brain in good health. And then what do you do afterwards? So if there is an issue, or if you're looking towards keeping your brain in good, healthy order, what do you do? All right. So for those of you who may not be aware, let's talk a little bit about what is an audiologist. So an audiologist, we primarily evaluate, diagnose, treat, and manage hearing loss and balance disorders for people of all ages. It isn't just someone who works with hearing aids, but we work in a wide variety of settings. So hospitals, clinics, I work in a private practice. Some work in ENT or ear, nose, and throat physician offices, in the schools, in the government, in the military, and in the VA. We recommend that people have their hearing checked once a year. So not unlike other checkups that you might have for, as I said, your eyes, your teeth, etc., your hearing should be a part of your overall wellness check. And I think what I want to also point out is that oftentimes we test children, or actually we test children all the time, because we understand the link between hearing and their ability to develop speech and language skills. And what often happens then is that we as a society kind of forget about you, and we wait until you get to the point where you're older and maybe you're starting to have issues. And what we'd really like to see is a trend towards checking hearing over your whole lifespan and keeping an eye on it and helping you to protect hearing as you move through life. Some of the common tests that you might see as a part of a hearing evaluation or an audiology evaluation, certainly audiometry. Audiometry is what you might think of as listening for little beeping noises and pressing a button whenever you hear one. We also want to look at your middle ear function. So how well does your eardrum move? How about the little muscular contractions that happen in the middle ear system? So there are muscles that attach to the smallest bones in your body, and they often contract as a protective mechanism for the inner ear. Speech testing would be how well do you understand speech, both at comfortable listening levels and also at soft levels. So both from a discrimination standpoint as well as an understanding standpoint. We often also do speech and noise testing. So it's great if you can hear things in quiet, but many times people complain that when they go to places where things are noisy, their performance starts to drop. Electrophysiological testing is really testing the physiology of the ear. Things like auditory brainstem response testing. So again, how about that connection from the ear as it moves through the auditory nerve and up to the brain? Otoacoustic emissions are responses from the inner ear. So there are little nerve, little hairs that are tuned kind of like keys on a piano in your inner ear. That's also called your cochlea. And we also want to check the performance of those hair cells. Then obviously we do hearing aid fitting. Speech mapping in real ear is a verification measurement to make sure that hearing instruments are performing properly. And I would also add cochlear implantation to that as well. So mapping and testing of cochlear implants, auditory rehabilitation, and balance testing. And what I also want to make sure that you see is cognitive testing. So cognitive testing has now become a very common measurement that should be performed when you go for an audiology check. So when the American Alzheimer's Association did a study recently about what people were worried about as they age. And you can see from both the silent generation, the baby boomers, Gen X, and millennials, across as they age, what are they most concerned about? And Alzheimer's disease ranked #1 with all age groups. And so people are worried about it, even more so than they are of cancer or stroke or heart disease. So it's really important that we pay attention to um, lessening some of the fear around cognitive performance and helping to aid that performance throughout your lifespan. When we think about different types of cognitive impairment, not all cognitive impairment is Alzheimer's disease. It's not even all dementia. You can have mild cognitive impairment where you may start to feel or notice that you're not performing quite as well as you used to. Maybe you have more difficulty remembering certain items or even just putting together information. I would call that the thinking skills portion. Um, it may be measurable. It may be something that when you're in that category of mild cognitive impairment, instead of allowing it to just progress, there are things that we can do to help improve it. If it does progress, it may turn into dementia, where you're impacting more than just one cognitive domain. It may interfere with a number of different things in your cognition, and it can interfere in your just everyday life. Once things progress into Alzheimer's disease, that is a more severe, significant impact that it's having on you. And if they were to do scans of your brain, oftentimes there are changes in brain structure or gray matter. So it becomes much more difficult to rehabilitate at that point. So why would hearing health be connected to brain health? Um, what we know now from studies is that untreated hearing loss not only leads to isolation and loneliness, but it's actually people with untreated hearing loss are 5 times more likely to develop cognitive decline or disorder. And that may turn into dementia or Alzheimer's disease. But what we really want to do is even keep it from getting to that point of mild cognitive impairment. We see people that have hearing loss and develop those things over time. If they do treat their hearing loss sooner rather than later, it can impact the risk of cognitive decline. So how does that work? And why would that work? Because you would think, and honestly, if you used to think or you still think that the ear is kind of living on its own little private island, I think we all kind of had that feeling at one point where the ear was just taking in information, but we didn't necessarily recognize the impact of the brain and how auditory processing could impact our ability to perform. So when you have hearing loss, it puts a greater strain on your brain to try to filter information. It puts a heavier load on that particular performance function. So we call that cognitive load. It just makes it harder. You're having to work harder, so to speak, to understand things. Over time, with hearing impairment, if the brain isn't being stimulated properly, it can actually change brain structure and function. And then obviously we know that when people aren't hearing well, they tend to withdraw from social situations. They isolate. That gives them even less stimulation. And then that in turn can turn into impaired cognitive function and then potentially dementia. What's really, really interesting is that when we look throughout the lifespan, early life, midlife, and later in life, and the things that can actually impact cognitive performance, you'll see that the area of midlife, the biggest thing in your midlife that can contribute to whether or not you develop cognitive performance issues is hearing loss. So it is the one thing that you can do. It's a modifiable risk factor that they have seen in studies that if you treat your hearing loss, it can be something that causes your cognitive decline potentially to be less impacted. And they are seeing in greater research that correlation between stopping or even potentially reversing cognitive decline by treating hearing loss sooner rather than later. And I'll just read this quote because I just find it so fascinating from the Journal of American Geriatric Society. Providing hearing aids or other rehabilitative services for hearing impairment much earlier in the course of hearing impairment may stem the worldwide rise of dementia. So treating your hearing loss sooner rather than later is really a benefit to everyone worldwide, especially those that are even at greater risk for developing dementia because of things, even, not just hearing loss. So now we have better tools. It used to be when you would go in to have a cognitive check, they might give you a piece of paper, they might tell you, here, draw this clock, or they may ask you certain questions to try to check your cognitive performance. And we have a tool now that we're using actively in our office to look at different aspects of cognitive performance. So the equipment that you see pictured on the screen is called the Thrive test by a company called CogniView. And this is based on well-documented cognitive research and standardized peer-reviewed literature from the area of cognition. So they've developed a test that's very easy. It takes about 5 minutes. It tests different areas of both cognitive performance, so things like memory, visual spatial relationships, executive function, which is like decision making, and then also how fast you're processing things, so reaction times and your actual processing speed. So I'm going to show you a little video now that will explain a little more about this test and give you an idea, again, of the relationship between brain health and cognition.
Welcome to CogniView. This is a screening to measure your cognitive performance. Cognitive performance is how your brain performs. Like your cardiovascular health or other important functions of your body, brain health should be a part of your routine health checkup. You may think brain health decline is only connected to dementia or Alzheimer's disease, but that's not true. It can be related to a number of risk factors like diabetes, hearing or vision issues, medication side effects, or even lack of sleep. Early detection and risk reduction of cognitive decline is quickly becoming top of mind within the healthcare community. Recent research efforts have helped us learn much more about the importance of brain health and its relationship to your overall general health. Monitoring your cognitive performance, making good wellness choices, and partnering with your healthcare provider is a winning combination for managing your brain health. This is the CogniWheel, and it is your only interaction with the screening. To get comfortable with the CogniWheel, go ahead and try it right now. Rotate it left and then right. It's not an IQ test or a series of questions and answers. It's a series of different exercises. Before each exercise, you will be provided with 2 practice sessions before you take the measured exercise. Motor skills. In this exercise, we will be capturing your current motor abilities, which differ from person to person. The exercise requires you, to the best of your ability, attempt to keep the green wedge on the moving white dots. Visual acuity. This exercise uses the same green wedge, but this time you're being measured on your ability to track the moving white dots as they become more faint. Word perception. This exercise uses common 3-letter words within the English language. You are challenged to find the real word among non-word symbols. In this shape perception exercise, you are asked to find a shape that is different than the other shapes. These are not normal shapes you would expect. Rather, they're visual cues to help us measure your ability to perceive which shape is different than the other. Word memory. In this exercise, we use the 30 most common 3-letter words in the English language. A word will be placed in the center, followed by other words. You will be asked to remember and select the first word shown. This exercise will be extra challenging if you don't follow the instructions. The instructions will ask you to remember and identify the word that appears in the middle first. Select the correct word as quickly as possible. Shape memory. In this exercise, you are challenged to remember shapes that are unique. These are not normal shapes that you would expect. A shape will be placed in the center, followed by other shapes. You will be asked to remember, identify, and select the first shape shown. Let's review again some important recommendations. Eliminate distractions like your cell phone. Keep friends and family at a distance as you do the exercises. Stay focused on each exercise. If you wear vision correction, please use them before the exercise begins. Use your dominant hand, which is usually the hand you write with. It is very important you read all instructions carefully. Stay calm under pressure. Each exercise will get progressively more difficult. Select the right answer as quickly as possible. If you remember to follow these suggestions, it will help us get the best measurement of your current cognitive performance. Once the screening is complete, you will receive a personalized 1-page report from a cognitive performance representative. Welcome to CogniView.
So what does that performance report look like? So on the left side of your screen, you're going to see the actual printout that you would get. The printout is normed based on your gender as well as your age as well. So we enter that information into the Thrive equipment so that when you're taking the test, you're actually being, it's being looked at based on your age and your gender. So it's not like you're being compared to someone who might be a young person. It's very personalized to you. You'll see also on the left side, there is a speedometer, which shows kind of like a stoplight, so red, yellow, and green. If the needle falls within the green, we would say that based on your age and your gender, you're falling within good abilities for that particular area of performance. If it's in the yellow, it would be an area of caution. So people that are falling into the yellow, we may make recommendations for possible next steps or interventions to help improve some of those cognitive skills, and then retest you periodically to see if we're getting improvement. When things are in the red, those are times where we may actually want to refer you for more in-depth testing to a neurologist. So that would be beyond the scope of what an audiologist would do, but it would give you certainly some cues as to whether or not you needed attention from a specialist. What we also do is then take some information from things like the processing speed, the reaction time, your memory, and how well you're able to perform. And we're going to use that information together with your audiology evaluation. So how well do you hear? And then how well is your brain putting that information together? It's almost as if cognitive performance has been the missing piece of the puzzle as far as audiology goes. You know, for years we knew as a profession that this was impacting the performance of people as they're being treated with things like hearing aids, that maybe though some people were not performing as well as others. And we just didn't have a good mechanism or research behind what we have available now to really see how cognition and hearing fill in some of that missing piece of the puzzle that we just never knew before. When you have good cognitive performance, your brain is better able to filter information. So that may do things like ease language understanding or give your performance in noise a boost because your brain is better able to filter some of that information. How well does your ear work? How much cognitive load or listening effort are you using to try to hear in certain situations? When we do speech and noise testing, I mean, we want to put all of those pieces of the puzzle together, and being able to test your cognition is just adding to that. Executive function I didn't talk about, or memory specifically, but I would put that all together. You know, how well your brain's able to make decisions and how is your working memory. So think about a computer and how much working memory that it has in any given environment. It puts a greater strain on the brain when it has to filter lots of pieces of information. So I want to make sure that you remember that cognitive performance screening is not something you need to be afraid of. We actually want you to test it early and to test it often. In fact, I even tested every member of my staff, both so that they could have a feel for what the equipment would actually do, but everyone said, wow, I just had no idea. That was harder than I expected. I think sometimes we take those things for granted. This type of test is very easy and it's quick, but it's a screening. It is not meant to replace any kind of diagnostic test, nor is it something that we're going to use to diagnose you with dementia or Alzheimer's. It's just to get a feel for how well your brain is performing. So remembering back to that interesting graphic with the lines and the circles, that independent research showed that hearing impairment is the #1 modifiable contributor to cognitive decline. So what that really means is that we need to embrace hearing health throughout our whole lifetime and understand that treating hearing loss sooner rather than later is what we as a whole society should move towards if we want to improve cognitive performance in our later years. If you come to us as audiologists, we can correct both your hearing loss to treat that sooner rather than later. And then we may also give you some resources or tools to work on some of those areas where you might be in the caution areas, or just to keep things stronger. So if you think about physicians talking to you about doing crossword puzzles and things like that, these are very targeted areas of recommendation that you can do easily at your home. Many of our resources are computer-based or web-based, so you can do them in the comfort of your own home and kind of work with them more consistently. What we also know is that it oftentimes takes people a long time to treat the beginnings of hearing loss, that usually people will wait on average 7 years. So, you know, the graphic of 5 to 10 years before treating their hearing loss, you know, the statistics show that it takes people a long time to move towards treatment. So we want to see you when, even if you just suspect that maybe you're not hearing well, or even better yet, we're just testing you as a part of your overall wellness check so we can start to see even very small changes in your hearing sensitivity. Brain health and awareness and access to these kinds of screenings has been called the most important and urgent challenge of the 21st century. But the good news is that we have the ability to test those things very easily, and it doesn't take a lot of time. All right, so I'm going to stop sharing my screen now. That's it for the actual kind of lecture portion of today's engagement, but I'm really excited to see if there's any questions that you guys might have.
Yeah, actually, there are questions. So I'm going to start the first one that came in. And can you talk about your insurance and Medicare and what you accept for payment, and then or is it just a private pay facility?
Yeah, so my particular office, we work with all major insurance companies, Medicare, United Healthcare, Blue Cross Blue Shield, Cigna, Aetna, all of them. The downside of this type of testing is that it actually is not a covered benefit of insurance. It is not something we can bill directly to insurance, but the cost of this test screening is $35. So it's not a significant cost if you're interested in just coming in and having that piece of the puzzle tested.
But hearing tests would be any hearing tests or hearing treatments would be covered in some form based upon the insurance.
Based upon your individual policy. So diagnostic testing is covered by most all major insurers, Medicare included. Medicare specifically excludes hearing aids and related services beyond the diagnostic testing. And for that, I mean like your straight Medicare insurance, not a Medicare Advantage type plan. Some of the new Medicare Advantage plans that we have access to now does have some hearing aid coverage or benefits that can be used. So it's nice that we're starting to see some of our insurance companies seeing the value of treating hearing loss and giving some insurance coverage for that.
And Kaiser, you didn't mention Kaiser, but I'm assuming Kaiser would not be part of that plan, right?
It's not something that I can work with as a private practice because they have their audiology
They have
services
their own audiology.
in-house. But typically, my understanding of Kaiser is that they, for most of their plans, they do cover diagnostic services. I don't know if they have access to cognitive screening tools at this point. They may, but it would certainly be worth asking the question to them.
Excellent. Can you talk about what, give us an example of what a patient experience would be? So a new patient coming to your facility, what can they expect?
Yeah, absolutely. The first thing that we want to do is, you would maybe get paperwork done. Unfortunately, I know paperwork is like everybody's nemesis. We do have the ability to send you a link to our patient portal where you can actually fill out paperwork online before you come in, which is maybe a little bit nicer. Once we have that information, the first thing we want to start with is a hearing evaluation. We want to see what is your hearing status at this point. Talk a little bit about your history, what your risk factors are. As we just talked about, much of that is covered by insurance. If there's anything that comes up in that test, then we may make a medical referral. So if you have something that could be medically treatable, we want to get that taken care of first before we look at any treatment options for audiology.
That's great. Doctor, can you talk about some of the signs of hearing loss that people ignore? Because I know you said 7 years is the most common. And, my parents, as they were getting older, I'd say, "Mom and Dad, you're not hearing as well. I hear just fine. And it's you don't talk loud enough anymore. So what are the what are the more common things that you can recommend to people that maybe they're ignoring that they should be paying attention to?"
Yeah, and I giggle only because that's a really common reaction. You don't know what you don't know,
You're
right?
mumbling.
You're mumbling, and honestly, that is one of those things that you want to pay attention to. If everyone is mumbling, at some point you have to say to yourself, maybe not, maybe not. That may not actually be the answer. It may be something that's happening with my own hearing, but. Yes. So are people mumbling? Are you asking for frequent repetitions? What did you say? I didn't understand. You're misunderstanding. Maybe things sound the same. Oftentimes, beginnings and endings of words tend to have higher frequency consonant sounds. So, the question becomes like, did they say sit, fit, kit? It starts to not make sense because you may be missing some of those key elements to the sentence. One big one that we often see is that people start turning their TV volume up. And that, that may not be a complete diagnostic tool, but honestly, if the people around you are like, whoa, oh my gosh, I walk into your house and my hair's being blown back by the TV volume, that would be a good kind of push for you to get your hearing checked.
And so you talked about good hearing health. What are like the things that people can do naturally to just do a better job of managing their hearing health?
I love that question because we often don't start talking about hearing until there's a problem.
Mhm.
And really what we want to see is people valuing their hearing, understanding that, the vast majority of hearing loss that we see is due to damage in the inner ear, so the little sensory hairs. Right now, we see the number one cause of preventable hearing loss being noise exposure. It is a really noisy world, and it feels like it's getting noisier and noisier as time goes by. And people are wearing things at ear level. They're wearing a lot of headphones. I don't think you can walk around anywhere now without seeing somebody with something sticking out of their ears, and watching those volume levels. So we want to protect the good hearing that you do have, and whether that means hearing protection, so just even simple squishy roll up earplugs in your ears when you're going to loud activities or events, or even more customized products, or taking ear rest. So even just giving your ears a break, if you're in a loud environment, just even stepping out and giving, even 10-15 minutes of calm and quiet can help in the long run. So we want to look at protecting those precious hair cells, which, once they're damaged, is a permanent condition.
What about supplements? You had mentioned a couple of things. One was hearing loss going into dementia. So are there supplements or medications that work well for either of those conditions?
That may be a better question for like your primary care physician, because obviously there can be medication interactions that would occur. At this point in time, there isn't any kind of herbal supplement or dietary supplement that we can recommend that shows good clinical relevance for preventing loss of hair cells, or sometimes you'll read things about CoQ10 as being something that has the potential of helping to maintain good inner ear hair cell performance, but at this point I don't think we have enough studies to really prove it.
And since this is a personal issue, and I know there's a lot of people on this call that would be exposed to this, tinnitus is a extraordinarily common problem after the age of 60. What are the things, the new things that can be done to identify and treat tinnitus?
Sure, that's a great question as well. Tinnitus, we actually see more people that have tinnitus than we see that have hearing loss. They estimate there's 50 million people in the US with some form of tinnitus. It may not be sustained, it might be intermittent, whereas hearing loss occurs in about 32 million Americans. So there's a much greater number of people with ringing in their ears than there even is hearing loss. And so you can have ringing in your ears without hearing loss, but it's less common. More commonly, we do see hearing loss and tinnitus go hand in hand. I want to make a little addition to just kind of infusing that discussion about herbal supplements. If you were to Google tinnitus, you are going to see a laundry list of different kind of, herbal supplements and drops and things like that. At this point in time, we don't have any good clinical research to prove that that helps beyond what a placebo effect would be. And what that means is it doesn't have any greater effectiveness than taking a sugar pill. You can take it. There are some people that feel like they get benefit or reduction in their tinnitus, but it's not proven. So I can't necessarily recommend it for anyone at this point. The one alternative medicine area that's getting some good attention and is showing good results in some of the clinical studies is acupuncture. Acupuncture in treating tinnitus works in about 50% of cases. So at least getting some reduction in that tinnitus awareness or disturbance of the tinnitus with the treatment using acupuncture. So that might be one thing that we talk about if you came in for a tinnitus evaluation. Other things that we use are sometimes we treat the underlying condition of hearing loss first. Again, looking at that hearing and brain connection. If the brain isn't being stimulated, oftentimes it is, not getting that information appropriately. So it starts to develop its own internal sound, if you will. That's kind of the short version of what is tinnitus and where does it come from. It is a phantom sound. It falls in the same medical category as phantom limb syndrome. So if you think about people who feel pain in a limb that's no longer there, that it's the same type of phenomenon, it's just an auditory phenomenon. So sometimes if we treat the hearing loss, the brain goes, oh my gosh, there's that sound I've been missing. And so it may relax some of that response.
Interesting. And what about, you mentioned hearing loss treatments. What are, I mean, outside of hearing aids, are there other treatments?
It depends on the root cause of your hearing loss.
Mhm.
So if you have hearing loss due to wax production or overproduction, and we remove the wax, now you're hearing better.
Interesting. Interesting. You talked about how do you recognize MCI? Are there specific ages when that is recognized, or can it be at any age? And are there any medications that are effective with that? Again, probably asking you a question that you can't answer, but I'll ask it.
Well, it's actually a good discussion, I think, anyway, because you know, we I think previously have been looking at MCI or mild cognitive impairment primarily in older people, and what we're seeing now is that, you know, with contact sports, we're seeing mild cognitive impairment even include children. So using screening tools like the Thrive test at younger ages, so we have a baseline, and then as they are participating in some of these types of sports where there may be head injury or concussion trauma, how is that impacting cognitive performance? So audiologists now are working on some of those brain injury teams as a part of that, you know, kind of overall team performance remediation options and solutions for people experiencing that. So I would actually recommend looking at it throughout your lifetime, again, along with hearing checks.
And what about diet? Is there anything, we hear diet all the time impacts so many things in our health, everything. Is it also related to to hearing loss or ear health?
We talk about it more in relationship to tinnitus, quite frankly. There are many things with diet that can impact tinnitus, excess salt intake or sodium intake, so limiting things like processed foods, or I'm not just talking about like table salt, but sodium, if you look, canned foods, processed foods have a lot of sodium, and they can cause an increase in tinnitus performance or perception, I should say. So that's one area. Caffeine, nicotine, all of the vices, I like to say, can also impact tinnitus more specifically.
What about cannabis? We had a meeting yesterday on cannabis. Does cannabis have positive or negative impacts on hearing and hearing health or tinnitus?
We're starting to see some studies around the use of CBD oil for tinnitus, not for hearing loss, but for tinnitus, and they're just in that starting beginning stages. And I do think that it has more to do with the brain reaction as opposed to what's happening in the ear. At this point, I don't have any studies I can point to that would improve hearing loss or protect you from hearing loss, but maybe someday.
And staying away from loud noises.
Staying away from loud noises. Yes, that's number one. Number
Number one.
one.
I don't have any other questions, Doctor. I don't think we have any additional ones from the audience. And I just want to thank you for really helping us understand so much more about how hearing loss impacts the brain, and gave us some real good practical advice on what we should be doing, because many of us don't pay attention to our hearing. Like you said, we take it for granted, like our sight, and we only pay attention to it when there's an issue. So we thank you so much for a wonderful presentation, and I hope everyone learned a lot today, and everybody has a great afternoon.
Thank you so much. If I can impose
Sure.
on you for just one more minute,
Go
because
for
I
it.
want to give just one more little tidbit
Mhm.
of information. For those of you out there that are thinking to yourself, well, I can't afford hearing help, but there's a lot of story around that. I do want you to know that myself and 6 of my colleagues around the state have kind of come together to form a nonprofit organization or a project called Hearing the Call Colorado. We actually had our first mission in Longmont on Saturday, and so we served income qualified people that need hearing help and hearing help services, so it doesn't have to be out of reach. So we are coming together to help people that at low or no cost to you. So if you're looking for more information around that, you can go to hearingthecallcolorado.org or hearingthecall.org/Colorado if you want to check that out. And our website at longmonthearing.com also has a lot of information and even an online hearing test that you can check out and test your own hearing, see how you're doing.
That's great information, and that nonprofit is very, very interesting. Wish you well with that as you continue to grow it. Again, thank you everyone for joining us today, and we'll see you tomorrow, same time, same channel. Thank you. Good job.
Bye-bye. Thank you.
Bye-bye.